Hi, my name is Andrea Shercoke, and I am the Public Programs Manager of the National Museum of Health and Medicine. The Medical Museum is a Department of Defense museum and an element of the Defense Health Agency. The museum has, for over 160 years, shared the triumphs and challenges of military medicine. Today, we're really excited to share this Science Cafe with you to commemorate Traumatic Brain Injury Awareness Month. We're going to be joined by some of our colleagues from the Traumatic Brain Injury Center of Excellence, and we're going to learn a little bit about how headaches and traumatic brain injury relate. And we're going to learn a little bit about the history of how traumatic brain injury has been treated and some of the ways that headaches have been treated. And then we're going to take a look at some of the resources that TBICoE have created to help us better deal with headaches in the world today.
Hi, I'm Joanne Gold. I am a clinical pharmacist and a contractor at the Traumatic Brain Injury Center of Excellence, or TBICoE. And today we are here at the museum to talk to some experts. We're going to talk about the historical treatment of headache, a little bit about TBI. I'm going to talk about ways to improve headache treatment, and also talk about some TBICoE resources. So as you know, TBI is a worldwide significant health issue. It affects both military and civilian populations. And in both the military and the civilian populations, mild traumatic brain injury or concussion is the most common. And concussion can result in a broad range of symptoms, such as sleep disturbances, cognitive complaints, and headache. So unsurprisingly, headache is the most common symptom following concussion. And headache can really impact our lives. So I don't have to tell you how important it is to have effective headache treatment that actually works. But for now, we're going to head into the past. We're going to hear about historical treatment of headache, some things that worked, some things that didn't work, and probably some things that did more harm than good. So let's go.
I was curious about the historical understanding of traumatic brain injury and how it used to be managed, compared to what we know and do today. So I started off my adventure into the past by speaking with the historical collections manager of the museum, Mr. Alan Hawk.
I think the first thing to understand is traumatic brain injury is very much a 21st century construct. When they looked at it in most of the 20th century and kind of late 19th, it was all about the pathology, the physical appearance of what an injury, a wound was. They would describe it in terms of how far the bullet or fragment penetrated the skull, what happened to the brain inside of it, but it's described in appearance, not in any functional terms on it. So the terms were very pretty much either the bullet penetrated the skull or it didn't. If it penetrated the skull, did it tear out part of the brain? That kind of thing in there. Did the bullet go into the brain? Did it go through the skull and pass outside of it? Perforating wound versus a penetrating. That is how they described it back then. They didn't really talk about traumatic brain injury when we talk about today. We're talking about in terms of functional, of cognition. How does it affect the person? Do they have headaches? Do they speak clearly? Do they stutter? Those kind of things. They really didn't describe it in those terms in World War I, World War II. So,
Can you tell me a little bit about how TBI was managed? I mean, even going further back than the Civil War.
well, a lot of times they would treat it. And again, they look at it and say, okay, this person suffered a skull, a skull fracture, depressed skull fracture was the main thing that you would use a trephination on. And trephination is cutting a hole into the skull to relieve pressure on the brain. And what was on there? And I think it had like maybe about a 45% survival rate. It was not very good. Of course, it was better than nothing, but
Right.
as most surgery at that time period was. But you'd very carefully cut into the skull these things, and you just basically cut an opening into the skull, probably about 3/4 inch diameter.
Wow.
And sometimes if you cut around the perforation, where the depressed skull fracture, it relieves some pressure on it. Now, the 21st century management of that is what they do is a craniotomy. And instead of just cutting a small hole in the skull and leaving it, what they started doing was they were actually took out a section of the skull. And sometimes they would discard it, but a lot of times they started just putting another part of the body, like they put inside the chest cavity for a period of
Really?
time, just when they ship them across the street, across the ocean. But again, the idea was, again, you're giving the area for the brain to expand into. What they were seeing was this was the damage of it was, caused by it, like an IED and
Mm-hmm.
things like that. The brain swelled. Of course, the skull does not allow for the brain to swell into it. So you take off part of the skull, it gives brain area to expose to swell. Eventually, the swelling dies down, and then you have the piece of the skull that you could actually put back on to the
Wow.
patient and recover on that. That requires much more sophisticated surgical procedures than they were able to do in the Civil War.
Do you know if there was any like type of anesthesia that was used, or do patients just kind of have to grin and bear it?
During the Mexican-American War was the first use of chloroform and ether on military cases. Most of the surgical procedures performed at that time was going to be an amputation. And it was kind of anesthesia. Mexican-American War actually had kind of a mixed record. The doctors were not convinced it was a good idea. Patients didn't seem to recover very well from it. Now, part of it was a very, very novel technique. So people hadn't really discovered how to do it subtly and the nuances of administering anesthesia. During the Civil War, it was better known. Again, most of the procedures were amputation. When you're doing surgery and wartime surgery, a lot of times you were doing it outside. You did it because you had plenty of light. You could see better. The problem was everybody could see what you were doing too. And so when they gave anesthesia to a soldier, it was kind of a low-level anesthesia, what they would describe today as a low-level anesthesia. So frequently, even though they weren't feeling the sharp pain of the instrument cutting into them, they did feel something.
Yeah.
And they reacted to it. So they moved. And again, somebody walking by, they're seeing the assistants. The job of a surgical assistant was to hold the patient down. They would see the patient moving around. They'd see the guy cutting off, doing the surgery, which is a very brutal thing anyway. And the logical conclusion was there was no anesthesia given. That's where the story comes from. But actually it was given. But the one thing was, they didn't understand the importance of anesthesia. It was not so much it relieved pain, but it also bought the surgeons time.
Right.
And they could do the procedure. They didn't have to be as fast. They didn't have to cut through as quickly. They didn't have to get everything done as quickly.
Mm-hmm.
And they could do more complicated surgical procedures. So that was what was important with anesthesia.
Well, I guess we're glad that we live in the modern age of medicine, right?
Yeah.
It's terrifying.
I wanted to learn more, particularly about the historical understanding and treatment of headache in general, and how it's evolved over time. Luckily, the museum is full of experts who are very knowledgeable about these things.
So one of the earliest ways was a plaster, which is like a poultice. And that was used by one of the earliest instances we have is Hildegard of Bingen, who was a medieval mystic. And she used a opium and vinegar poultice. And whether it was the vinegar or the opium, it's hard to say. But as you can imagine, with vinegar, it has sort of a cooling effect, which is helpful with a headache. And she suffered terribly from migraines. And it's thought that some of her mystical visions, whether or not they were still a product of her faith, of course, were also a product of these terrible migraines. In addition, U.S. Grant, the Civil War general and of course future president of the United States, used mustard plasters, which were also a very, very common treatment option because mustard has a heating effect, and sometimes heat can be very comforting and produce sort of a therapeutic effect when you have a headache. And he wrote in his memoirs, especially in stressful times during the Civil War, he used mustard plasters for his headache remedies. Bloodletting was used for hundreds of types of medical remedies, from asthma to stroke, for headaches, and including for hemorrhage, which may sound not like a great idea. But bloodletting goes back also thousands of years to the idea of humoristic medicine, the humors, which I won't get into. But in the 19th century, even though humoristic medicine had kind of fallen by the wayside, they were still bloodletting. They would open a vein with a sharp knife, usually the elbow or the knee. They would also use leeches. That is not a myth. They really did use leeches. So bloodletting was really common. Probably not terribly efficacious. Probably would have just made people lightheaded. So not the most helpful. And herbal remedies were used really commonly for headaches. So people would have been using herbs local to where they were from. They used aconite, belladonna, all the sort of typical plants that you would imagine in different preparations for that were fever reducers, which again is heat, because you feel that way when you have a headache. Often you feel kind of feverish. Fever reducers like sassafras or painkillers were usually herbal remedies, but really it's almost hard to say specifically because it would entirely depend on where you were geographically, because different plants grow everywhere and everyone in the world has headaches.
That is so interesting. Belladonna is actually still used today. Atropine is derived from belladonna, which, among other things, is used as an antidote for nerve agent poisoning. And there's a lot of instances of medications being used in the past that we still use today. But as you'll hear from Laura, there are some that we've stopped using because we've learned that they do more harm than good. Dun dun dun.
So when you get into medications that were used, like more of what we would consider medications, anyone who's had a headache knows how bad they can be. As soon as the late 19th century rolls around, every strong medication was kind of thrown at this. Morphine, calomel, opium, all of it. It was all thrown at. Alcohol, of course, was what many people used as sort of like a self-medicating. A lot of people, of course, used alcohol, especially if they didn't have access to a doctor. People who were sort of scholars and writing articles of the time really said a lot of these don't make much of a difference. And as we know, certain things like alcohol can make a headache worse or a migraine worse. They didn't understand at all really about what was causing migraines, because as we know today, headaches and migraines are caused by so many different things. How could they have conceived of headaches caused by TBIs, what we consider migraines, migraines, headaches from eye strain, there are so many different things. Imagine that no one really understands neurology yet. Like, that's kind of a tall order, I think. So a lot of times they were just kind of trying to manage the pain with sort of a rudimentary understanding of brains and kind of how they worked.
Alan also talked about the lack of understanding regarding the cause of headaches and migraines when I spoke with him. There were, however, a lot of different theories. Laura mentioned humoristic medicine previously, which was a theory that the human body was composed of 4 humors, including blood, bile, black bile, and phlegm. And Alan mentioned that before and during the Civil War, headaches were often attributed to digestive issues like constipation, and patients were given laxatives. But as you'll hear from Laura, the understanding and treatment of headache continued to evolve over time.
William Gowers was one of the most influential thinkers relating to what we would now call neurology, and wrote the most influential textbook of the 19th century. He went sort of far down a path of linking things like migraines to epilepsy and a lot of ideas that we would not consider, we would actually think today, well, that doesn't make any sense, why would that? But a lot of his core ideas offer some insight and value, even though his conclusions don't necessarily make a whole lot of sense. And his migraine treatments and his nerve treatments are really interesting. They give us a lot of examples of how he was considering treatment, and this would have been in the late 19th century. For migraine treatment, he suggested bromide, nitroglycerin, alcohol, hemp, chloral, morphia, valerian, caffeine, belladonna, aconite, of course, those we've heard of before, and even mustard plasters. And one of the ones that you may have heard of, but in a different context, is ergotin, which was a vasoconstrictor, which of course constricts the blood vessels, which is something that exists in our modern medications to treat headaches and migraines as a painkiller. But most people know of ergot for its actual dangerous side effects of ergot poisoning, which is very, very dangerous, very deadly. It's a fungus that can develop in things like rye flour. It is thought, in fact, fun fact, that it developed in the grain supply at Salem, and that is why people started seeing visions of witchcraft, and it led to the witch trials. Because it's so dangerous, it does lead to permanent brain damage, but it also has this healthful effect, but it's very dangerous. People were, as I said before, working hard to mix a lot of different medications and different painkillers to try and find something that would mitigate this pain that people were in.
Sounds like some crazy cocktails were concocted in an attempt to find relief. Have to give a big thank you to those who suffered through a lot of trial and error, so we didn't have to. In Gower's manual, he also discussed migraines and headaches occurring due to excessive brain work and deficient nerve strength, which made me wonder two things. One, do I need to work on my nerve strength? And two, what exactly was going on in society at this time that was causing this excessive brain work?
This is the 1880s. This is the Industrial Revolution. This is people starting to work either in factories and offices. They're not necessarily, not all of them are working as many agrarian jobs. There's pollutants in the air. They are working 12-hour shifts in factories. They're working 12-hour days in offices with poor lighting. Think about the society, how much it's changed. And it's not that people didn't have migraines before. It's not that people didn't get sick before, but think culturally about how much things have changed and how many external factors. There are huge accidents that are happening in industrialized factories, TBIs, what we would call TBIs today. All of these things change, and then you see that reflected in people's health, and you see that reflected in the medical literature of the time.
Also during this time, precursors to today's acetaminophen or Tylenol emerged. And Tylenol was actually discovered around 1878, but it wasn't used therapeutically until the 1950s because it was thought that other medications were safer, which, as you will hear, was not the case.
In 1886, when acetanilide was discovered, which is roughly the same structure of what we would say is acetaminophen, but important distinction is, while acetaminophen is safe, acetanilide, which is actually mentioned here, although it looks here to be spelled acetamilide, which is one of the issues of archival research, of course. Acetanilide was unfortunately carcinogenic and actually caused liver and kidney damage. So obviously, we're very grateful that is no longer on the market. But what you'll see in this book is that it was a component in the recipe for a headache treatment, in addition to things like sassafras, bicarbonate of soda, other things that this doctor used to create his own recipe for a headache cure. So this is all happening culturally around the same time.
I remember learning about patent medications that were marketed as like miracle cure-alls that emerged along with the rapid increase in industry that was occurring at this time. I asked Laura if she could tell us more about these patent medications or these cure-alls.
One of the sort of consequences of both industrialization and the rise of these medicines was, as always, the rise of people who will want to make a buck from this medicine, which led to the rise of quacks and patent medicine and cure-alls, which, though they had existed before, really sort of exploded in popularity in the late 19th century. And it wasn't just in cities, it was particularly common in the countries where, or sort of in the countryside, where you might have someone who might have like a wagon with like the new pot that you need, some fabric that you want, and sort of a cure-all patent medicine in a bottle that'll cure what ails you. Whatever ails you, it'll cure it. And these were, they could kind of run the gamut from being completely innocuous to actually being really dangerous. And the purpose of them was to make money. So they weren't going to have anything that was like a high quality ingredient, but they could have alcohol in them or laudanum. And it could certainly be enough that you wanted to buy it the next time the seller came around, and it could certainly lead to an addiction. And what was dangerous about this was, of course, that it was completely unregulated, and you were not getting your medication from someone who had training, either like a doctor or a nurse, or even from someone who in previous generations would have been like a local herbalist, someone who had probably been trained sort of like through an apprentice system, who would have known herbal lore, would have known how to reduce a fever with herbs, would have known childbirth, things like that. Those were all perfectly valid ways of taking care of your health. And the problem with patent cures is that none of that existed. And it really appealed to people, this idea that this was a cure-all. Just like if you've ever been up late at night and seen something advertised on TV and you've thought, oh, that's too good to be true, but maybe I'll just give it a try. You know, people want to believe. And it was no different all those years ago. People kind of wanted to believe, and it might mask the symptoms, but it probably wasn't going to fix anything. And that could also be dangerous because it might lead someone to not go to a doctor. Now, this also brings up the fact that people might not be able to afford to go to a doctor. There's certainly that, issue going on there. But it could mask symptoms. And also, of course, doctors didn't like these patent medicines. They didn't like these quack doctors, these quack cures. And so sometimes a doctor would ask a patient, have you been taking any patent medicines? And the patient, once they finally went to a doctor because they weren't getting better, and the patient might lie. And so what if the patient had been taking a patent medicine with laudanum and then the doctor prescribes laudanum? Then now they're taking what may not be a double dose of laudanum, but more than they should because they don't know. Which is, for example, why, when we go to the doctor and our doctor always asks us, are you taking any over-the-counter medications? Because they don't want to, have any drug interactions that are dangerous. And in cartoons of the time, things like that, you see references to quack doctors. They were much maligned. And a lot of doctors and social reformers, what we would now kind of call social workers, but people who worked in public health, they were really angry at these patent medicine people because it wasn't just a placebo effect. It was, they felt, discouraging people from getting treatment. And so that could be really dangerous. And a lot of them were also angry because they felt that there was not enough standardization in medication, even in the medication that was being offered by doctors.
It sounds like none of these medications, well, probably shouldn't even call them medications, none of these substances worked, and there definitely wasn't any type of regulatory body like the FDA. Luckily, the idea of standardizing dosing and ensuring quality eventually came about.
Some doctors felt that there needed to be higher standards from the American Medical Association. Like, that was also happening at this time. The functions that we have now, you have to think about it like that didn't just come out of nowhere. People had to fight for, what the Food and Drug Administration does. All of those types of organizations, somebody had to say, like, we should have standards. We should make sure that we have the highest quality control. We should make sure that our foods and our drugs aren't adulterated, because in the past, you could just have your medications be adulterated. There was a time where people didn't know that you shouldn't store the ether on your ship next to the boiler, which could make your ship blow up. It was bad. Things like that. And or that it made it less effective when it was stored improperly. And I don't know about you, but if I was a patient, I wouldn't want less effective ether. And those are all kinds of things that were happening in reform movements at this time. And patent medicines really got caught up in this. And one of the most important significant reformers was E.R. Squibb.
Dr. Squibb actually learned a similar lesson about not storing your ether next to the ship boiler. Let's listen to Assistant Archivist Trenton Schreck Havel tell us more about Dr. Squibb.
Full-on medical journal by Dr. E.R. Squibb of Squibb & Sons. His pharmaceuticals company eventually ended up, of course, getting bound together with Bristol Myers and Squibb, so very much still active today. But he ended up writing up these journals that were specifically his daily sort of experiments that he was doing in order to create the pharmaceuticals that he then marketed through his company. And in fact, this museum ended up purchasing several of those pharmaceuticals from him, either as examples of things that were in the field, or in the case of some of the preparations that we have, the specimen preparations, we were soliciting him for like isopropyl alcohol, because much like other actual bodily pharmaceuticals, isopropyl alcohol is a topical pharmaceutical one could think of, needed to be at specific purities or else it just wasn't going to function. And let's just say we have Civil War specimens here in the museum in part because of his pharmaceuticals, because they were a specific purity that didn't deteriorate the specimen. So, but for this book specifically, he was talking about trying to figure out better ways of ether and anesthetics. So, but as we can see, his experiments weren't always the most safe, and ether gas is actually extremely flammable, hence the singeing along this particular volume.
And I remember reading that Dr. Squibb was a big advocate for purity standards because, I think historically I remember reading about, tonics, elixirs, these patent medications that were prescribed by quacks and they didn't work. And he was probably the initial force behind making sure that these actual medications did work.
Oh yeah, absolutely. In fact, he was kind of one of the pioneers of that kind of prescribed pharmaceutical trend that I was talking about before, where before, pretty much anybody who, was willing to put out pharmaceuticals could market themselves as a druggist. And so you ended up with pharmaceuticals that were very haphazard in terms of what you were getting. Also, the idea of from pharmacist to pharmacist, you'd get, of course, major differences in what the overall standards were. And Squibb was kind of a early pioneer for the idea of having sort of broad standards that should, sort of be for that kind of purity of pharmaceuticals that he was putting out. So.
Before the FDA, there was Dr. Squibb.
Absolutely.
We talked a lot about the historical treatment of headache, and I wanted to take a minute to discuss ways to improve headache treatment today. So we often take medications like Tylenol, Motrin, or Excedrin as needed to make a headache go away. And this is normally fine for the occasional headache. However, if you start to notice that you need these medications more often, such as more than 2 times per week or 10 times per month, you need a higher dose, your headaches are getting worse, such as they're more frequent, severe, or long-lasting, or if they're impacting your daily life, then it might be time to talk to your medical provider, as these are signs that these medications aren't controlling your headaches well enough. You may need to try something else. Also, using these as needed medications too often could potentially lead to a rebound headache or a medication overuse headache and actually make your headaches worse. Be sure to also discuss with your medical provider any other conditions you may have, as certain conditions can be making your headaches worse or even causing them, especially post-concussion, such as dizziness or vestibular issues, visual disturbances, sleep disturbances like insomnia or obstructive sleep apnea, neck pain, and behavioral health conditions like PTSD, anxiety, or depression. Also talk with your medical provider about treatment options that may better control your headaches or work better for you. For more information on headache, including the newly revised clinical recommendation and the patient fact sheets, as well as other TBICoE resources, visit health.mil/TBICoE.
Thank you for joining us for this virtual science cafe that was brought to you by the National Museum of Health and Medicine and the Traumatic Brain Injury Center of Excellence.